Control console. The VeriSource control console consists of a personal computer with dedicated control software. A simple user interface is used to communicate with the console. To prevent tampering, the console is provided with 4 levels of password protection for treatment, physics, routine service, and major service. A laser printer is provided for clearly legible outputs. Esophagus. VeriSource is an effective method of delivering dose to esophageal tumors, which are difficult to treat effectively with external beam due to the close proximity of critical organs, spine, lung, heart, and the irregular shape of the target. HDR techniques result in much less dose to areas outside the tumor volume. Acute results are often excellent. Following HDR treatments, patients are often able to eat freely again. Esophageal HDR treatments are frequently administered on an outpatient basis. As compared to surgical intervention, the VeriSource HDR approach to management is extremely cost-effective and much less traumatic for the patient. Head and neck. Brachytherapy is often used to treat cancers of the lip, mouth, throat, and neck due to excellent cosmetic results and less interference with normal body functions. HDR techniques eliminate the staph exposure problems associated with these sorts of treatments. VeriSource provides needles as thin as 21 gauge and thin flexible catheters to make these head and neck treatments even easier to perform. Thin needles mean even better cosmetic results as well. HDR Remote Afterloader. The VeriSource Afterloader is designed for the utmost convenience in use. The VeriSource Afterloader incorporates a low center of gravity and wide stance footprint, making it very difficult to tip. VeriSource is mounted on wheels with 2 pivoting wheels for increased mobility. The Afterloader unit consists of the main electronics board with integral processor, a fire-resistant tungsten safe for the source wire, computer-controlled stepper motors to position both active and dummy wires to an accuracy of plus or minus 1 millimeter, an indexer which accommodates as many as 20 catheters cut to any length up to 150 centimeters, a battery-powered DC motor drive to provide emergency wire retraction, an uninterruptible power supply to enable treatment completion in case of a power failure, an onboard radiation detector to provide extra security that the source is safely parked in the unit following treatment, a manual retract handle to back up the primary drive and the DC motor drive for emergency source retraction, a unique position detection device incorporating 3 different length channels, a CCD camera, and interface back to the control console for rapid daily QA checks. VeriSource is the complete solution for HDR brachytherapy.